Hello, everyone. Welcome to another episode of the podcast. I'm joined by Dr. Shireen Kassam. Hello, Shireen.
Oh, hi there. So great to be there.
Fantastic. Nice to have you on. And Shireen is the founder and director of Plant-Based Health Professionals UK, and she's also a consultant hematologist. So we're very excited to have her on the show and also to just discuss a whole lot of different topics about a plant-based diet, Shireen's journey, some of her specialities around medicine, and how that relates to a plant-based diet. And we'll see where the conversation goes from there. But first of all, Shireen, I'd like to get you to start off with talking to the audience about why you'd want to choose a plant-based diet for health reasons.
Yeah, thank you. It's such an important question, isn't it? And I came to this realization quite late in my medical career. It seemed, 13 years into being a qualified doctor. But having adopted a plant-based diet myself, I started looking into the research about how to stay well and healthy, both physically and mentally, on a plant-based diet. And it soon became really apparent that there were so many benefits that could be gained by all ages and people for their health. So when you look into the evidence, it's quite clear that eating a plant-based diet can significantly reduce the incidence and prevalence of certain chronic conditions such as cardiovascular disease, type 2 diabetes, even certain cancers, and of course, help maintain a healthy weight. And as you know from your work, it's intimately related to the risk of getting certain inflammatory and autoimmune conditions. So, there seems very little that a plant-based diet can't help with. And so I think it's got to be the first and foremost approach for keeping healthy.
Yeah, and we can't forget the hot topic of the microbiome, can't we? With the fiber and the benefits of that, and how much research has come out in the last few years. Even it's been mind-boggling.
Yeah, you're absolutely right. I think, at the end of the day, the health of our gut really dictates the health of the rest of the body. And unless we provide a fiber-rich diet full of polyphenols and, prebiotics and probiotics foods, then, it's very difficult to come back from that. So, yeah, I agree that area is so important, and it's coming into its own in my field of cancer, just how we respond to cancer therapies may be predicted from the health of our gut microbiome, which is really exciting.
Oh, that's fascinating. Maybe we'll touch into that as we get further along in the program. But maybe we can discuss your journey about how you came into finding out about a plant-based diet and then obviously adopting it. Because I guess if you're like us, we didn't just necessarily go, hey, I want to do this. There was something that kind of triggered that kind of realization and the investigation as well.
Yeah, no, for me, it was very much the ethical reasons for not eating meat, dairy, and eggs. I became vegetarian back in 2001. And then, over a decade, realizing that the dairy and egg industry was just as harmful to animals and, of course, the planet, and realizing it didn't sit right with me ethically and morally to continue eating eggs and dairy. So I became an ethical vegan back in 2013. But when I then went on to research how to be healthy for myself, it sort of opened up this wealth of information, as I've said, and it took me a good sort of 3-4 years to, first start with the documentaries and the books, and then start reading the medical literature on diet and health outcomes, and realizing that it was a really great choice to make. And the closer you get to 100% plant-based diet, there's so many gains that you can make in your health. And once I felt comfortable in myself and being able to answer all those common questions, I thought, well, I've got to start talking about it, because at the time in the UK there wasn't much education, certainly in the healthcare community, about plant-based diets. Clearly there's always chat about diet, nutrition, and health, but it gets confused, doesn't it? So there wasn't a clear message or education program addressing those who do want to address their diet through a plant-based one, for all those reasons that we know, whether it be animals, personal health, or planetary health.
Yeah, absolutely. And the topic of nutrition is a really interesting one, because as a doctor, people come to you for advice on nutrition, but you don't really get a huge amount of training. I think if I can listen to some of the things you've been saying, you've had to go and research all those things that didn't really come up in your study. So, talk about that a little bit, and what you think about that, and maybe what's some of the things we can do, I guess, from the medical profession to try and improve that.
Yeah, no, it's a good question, and I think people really are realizing that we need a sort of broader education at medical school that really does address the root cause of our chronic illness, be it diet and lifestyle or socioeconomic factors as well. But I guess the current paradigm of medical education reflects what we have to do in real life practice, which is kind of firefight those who come through the door with chronic illness. And they're obviously coming at an end stage of illness, like the clients you see, I'm sure, and very little money or financial support or structural support at the moment is given to preventative care. So in the UK, only 5% of the NHS budget actually goes to prevention. So it kind of means that 95% of what we do as medics are after the disease has been diagnosed. And that means at medical school that kind of reflects what we're needing to do in practice. But having said that, you really can't learn everything at medical school. You get a broad brush overview of what you're going to be doing in real life practice. I didn't really learn hematology in medical school, yet I'm a hematologist. So there is a lot of postgrad education. We learn the basics about nutritional requirements, the biochemical processes of how all these nutrients work in the body. Mainly, I guess, focusing on deficiency, but not really kind of diet and lifestyle. But things are changing. It's being, like with all change, there is a demand by medical students, and also healthcare professionals want to teach the way they want to practice as well. So things are slowly changing. Just this year we're going to start some cooking for the climate. Dr. Hayley Tate in our team is going to be offering these modules at Exeter and Southampton University. So there is a slow shift, but like with everything in medicine, it's usually a decade before things are adopted, whether it be medical or supportive care treatments. And I think it is a lifelong learning. I don't think it matters when we learn this, but I think there just needs to be some acknowledgement that it is important. It should be part of our toolbox. And we're always going to need the super specialist people like myself as well, treating lymphoma, because I can't treat lymphoma with diet. But I think the fact that most of my patients also have diet and lifestyle related illnesses like type 2 diabetes, cardiovascular disease, I feel like I'm a better doctor for understanding those aspects of their health as well.
Yeah, I guess by doing that you can reduce the suffering, right? If they've got one issue, but then they've also got subsequent other issues, and if you can maybe help with sorting some of those other issues out, they can live a better quality of life. And also in terms of the education, I guess you're on the front line of teaching and educating doctors about how important lifestyle can be to make that change. And I guess that leads on really nicely to some of the work you're doing with Plant-Based Health Professionals UK. I mean, I remember, I'm pretty sure we were following each other when you pretty much roundabout just started it up, and it was a brand new thing, and it was a very small kind of operation, which now it seems to be much bigger. And obviously I'd love to come and attend one of your events one day, but in terms of how that's going and the kind of feedback that you get, just maybe talk about the beginnings of the operation and then where it is now.
Yeah, thank you. Thanks for asking. And I agree. I mean, I've been following your work with great admiration as well, and learnt lots from your journey and your support of clients. So thank you. And at the end of the day, it is people like yourselves and your clients that have benefited from this that keep us motivated, because it does seem a very uphill struggle most of the time. But yeah, so when I finally felt confident to start talking about this amongst my colleagues and peer group back in 2017, I sort of tested the water doctor came out and spoke at a VegFest event at October 2017, I thought it's about time I offered my knowledge to a wider audience. And VegFests, as you probably know, are really welcoming events. So I gave a talk on diet and the impact on cancer prevention and survival, and it got a really nice response. And I met some other health professionals that day that were also sort of well aware of this information and looking for ways of incorporating it into their clinical practice and getting the message out there. So I sort of realized that there was an appetite for this within the healthcare profession. So I decided, at the time I was working with another GP from Ireland, Tom Hubbard, who also was interested in getting the word out a bit more widely, and we decided to put on the first conference on plant-based nutrition in healthcare, which we did in March 2018 at my hospital, King's College Hospital in London. And it was a sellout event. Within sort of weeks of putting out the tickets, it was sold out with like a long waiting list. And I was like, well, wow, there clearly is an appetite for that. It was a small venue, 200 people, but having not known anyone in the space, to suddenly fill out a lecture theatre of 200 seemed quite unexpected. So from there, made connections and started building up a network, and formally sort of launched Plant-Based Health Professionals UK, which is a community interest company, which is kind of the equivalent of a non-profit organisation, in May 2018. So our mission is really to advocate and educate all parts of society, general public, health professionals and policymakers on the benefits of a healthy plant-based diet, and providing people with the confidence and know-how how to do it well throughout all life stages. I obviously have a passion for educating healthcare professionals, but we have loads of general public members and in our following, in our membership, who are equally benefiting from this knowledge, because at the end of the day, it's always the grassroots public that are going to be driving change and require our support. And of course, the vegan community also need to know how to follow a healthy plant-based diet in order for them to stay healthy throughout life, being a vegan for whatever reason. So we're a membership organisation. We're due to hit over 1,000 members this year if we carry on at the rate we're going. About 2/3 are healthcare professionals, and we have big hopes of being the biggest healthcare membership organisation in the UK, because we're open to everybody, as I say, general public, health professionals, organisations as well, if they want to join. And we dedicate ourselves to creating useful information, whether it be our webinar programme. We have a 21-day sort of online plant-based challenge created by Dr. Leila Dagan. We have fact sheets that are created and designed by our team and our members. So the great thing about having a membership is that all of that expertise can be used to creating our information. We write regular articles, and I write a weekly review of the news that goes out freely. And so lots of things going on. And I guess the most exciting thing this year has been the launch of an actual healthcare service. So kind of the pandemic lockdown provided us with an opportunity really to try and bring healthy diet and lifestyle to a wider audience. And people are getting used to seeing doctors and healthcare professionals virtually on Zoom like we're talking now. And so Dr. Laura Freeman, who's GP and lifestyle medicine physician, is medical director of a new initiative that we co-founded called Plant-Based Health Online. And it may be similar to what you guys are doing, but it's a multidisciplinary healthcare service with GPs, nutritionists and dietitian, where people can book an appointment for whatever problem they have. Maybe they don't have a problem, maybe they just want to adopt a healthy plant-based diet and healthy lifestyle habits, and really put that into action for themselves and their families. And we've started a program also of sort of virtual group consultations, which is kind of the efficient and effective way of delivering lifestyle medicine healthcare as well. So slowly ramping that up, so something to be aware of. And we're available for international consultations as well. So if people want to see dietitians and nutritionists, from overseas, that's absolutely fine too. So yeah, lots going on. And the
busy.
webinar program's been really popular as well, because it's allowed us, rather than in-person conferences, restricted to 200-300 people, we've sort of reached over kind of 8,000 people with Rahini Bajekal, our communications and nutrition lead, doing fortnightly webinars ever since the pandemic lockdown started, really.
Wow, that's amazing. And I think, full credit to starting off such a grassroots movement to something that's growing. Is the government recognizing some of the work you're doing, or the NHS, is it recognizing any of the work you're doing?
Yeah, I think it's difficult to know or quantify that. I think in general, the government and policymakers recognise, obviously the power of a healthy diet and lifestyle. The messaging is still conflicted and slightly confused from an outsider point of view. I think institutions and education organisations are. So you probably know that I run a course at Winchester University on plant-based diets and their applicability in clinical practice. So it's called Plant-Based Nutrition and Optimal Diet for Sustainable Health. And that's at Winchester University. I've been running that for 2 years. I never thought I would be given a university position to be teaching on plant-based nutrition. So that feels like, it's progress. And we've had over 500 people take that course. Again, majority healthcare professionals, but it's open to the educated health professional who's got a good background in science and nutrition. And as I say, Hayley Tate is going to be starting. So she's a GP, a cook, an author, and really teaching, healthy cooking through our program called Cooking for the Climate at medical school. So I think kind of the education bodies are, and I hope that then filters up more to policymakers. I guess we've had a bit of impetus recently because our national food strategy plan that you may or may not have seen online, was commissioned by the government. An independent group put together what we need to be moving towards as a healthy and sustainable food system in terms of production and consumption. And that's recommended 30% reduction in meat consumption and 30% increase in fruits and vegetables and 50% increase in fiber consumption. So, there's a trend towards more plant-based, but I don't think that's the language that's being used, of course. It's all about balance and everything in moderation. So we do have a lot of work to do still.
Yeah, it's a very interesting saying. I can't remember which health professional said this, but with everything in moderation, you get disease in moderation too, and you can't. People seem to neglect that part of the I guess the scales where you've got the diet in moderation, but then also disease. Talking about disease, a speciality of yours is cancer. So, in terms of some of the research on cancer that you've kind of delved into and in your own work, can you talk a little bit about I guess some of the things people need to know about cancer, and then also, where the preventative benefits are of the plant-based diet, and even I think with some cancers they are treatable. Some evidence is coming up around breast cancer and prostate cancer, and maybe even colon cancer. I think I've seen some research on that. So I've kind of given you a broad brush, but maybe just start where you think is important for people to understand about cancer and what it is and how we can help people who've got it or might get it.
Yeah, so I mean, it's a huge topic and there's great nuance, and because even just in my specialty of lymphoma, there's over 40 different subtypes, so it's hard to generalize, but we know that the prevalence of cancer is increasing. In the UK, the stats are that 1 in 2 of us in our lifetime will develop cancer. So it's something relevant for all of us, whether it be individual or for your family and friends. Everyone will know somebody. But of course, there is a good news story too, because 4 out of 10 cancers could be prevented, and this is obviously reflecting prevention in some of our commonest cancers. Lung cancer, sadly, is still very common globally, and we know that if we wiped out tobacco smoking, that would be virtually wiped out as well. But beyond that, we have the 3 other common cancers, so colorectal cancer, breast cancer in women, and prostate cancer in men. And as I say, 4 out of of 10 in general of cancers could be prevented. Now, diet isn't the only factor, but it's an important factor, of course. But so a healthy diet full of fruits and vegetables and whole grains, beans, really important. And this is acknowledged by the World Cancer Research Fund. So the prevention guidelines from 2018 that have been adopted globally clearly say eat a diet rich in fruits, vegetables, whole grains, beans, which is great, because for us that means a whole food plant-based diet. Whatever you choose to do around the sides, you know, kind of is your choice, but it certainly needs to be based around those healthy whole plant foods. And it clearly says to minimize, I mean, I tell everyone to avoid red and processed meat. You know, processed meat is a group 1 carcinogen and red meat a group 2 carcinogen.
Yeah.
You know, yeah,
absolutely. I think not enough credence was given to that report, was it? I think it was in 2015 when it came out, and it was kind of like, just like, oh yeah, you know, I remember watching a news story about it, and the guy was eating bacon at the, you know, at a cafe, talking about this and saying, oh, you know, but everything's in moderation, a little bit here and there doesn't hurt. And I think the advice that's given to people when they say that, okay, everything in moderation, or, you know, a little bit now and then, you know, what do they mean, you know, when they say minimize? And they're like, because not many people are aware of how minuscule those quantities are when they say minimize to this much, you know. Maybe you can just elaborate on that a little bit.
Yes, I mean, I think the language from the guidelines for processed red meat is really to avoid. There is no need for processed red meat. I mean, I think the harms for that, for both cancer, cardiovascular disease, type 2 diabetes, are overwhelming, that the harm outweighs any potential benefit. I can't think of a benefit really, unless that was the only thing that you had available to eat, and otherwise you'd become, you know, calorie deficient. So there is no place for processed red meat, you know, with the added nitrates and nitrites that we know really cause harm, and the saturated fat and the salt. So that's off the table. I think with red meat, the strength of evidence for cancer is not as strong. You know, as you know, all of this evidence comes from observational data. So it's sort of adding on extra items that
that's similar to smoking, isn't it?
It's exactly
we know that smoking causes lung cancer, and that data is observational too. So when people agree that smoking causes cancer, but then they question the evidence around meat and cancer, they kind of like contradict themselves in a way.
Well, in a way, but again, it's about the absolute risks. You know, 85% of lung cancer is caused by tobacco smoking, whereas you know, our Cancer Research UK says 13% of colorectal cancer is caused by eating processed meat. So it's kind of relative risks, and you know, so I think, you know, there is some merit in that sort of argument.
But then you've also got to look at the total population, right? Because 85% of smokers, which are not the general population. So if you look at the total numbers and things like that, it's different when you actually compare the two percentages. Even though 13 looks relatively small, when you look at the overall numbers, it's quite a lot of people.
Yeah, absolutely. I mean, I think, you know, we would prevent, I think the stats are that we would prevent an extra 10 cases in every 1,000 if we all kind of gave up red and processed meat. That's sort of degree of risk reduction. But as you say, it's kind of the whole package, and it's not very useful thinking about individual foods, but for processed meat, I think it is. You know, you should avoid that. With red meat, I mean, what people consider as moderate, in inverted commas, is, you know, eating 70 grams or less a day, really. I mean, it's something, a size that fits into the palm of your hands. But you know, you also have to look at it in the wider context as well. And I talk often about the planetary health plate, or planetary health diet, by the Eat Lancet Commission, that also takes into consideration health outcomes, but also what will be required to keep the food system within planetary boundaries for climate change. And for that, you know, red meat consumption has to be limited to once a week maximum. That's like one hamburger, a beef burger a week. Beyond that, on a global scale, if we're eating more, it's just not going to be sustainable when it comes to greenhouse gas emissions and land use and all those other impacts. So we can't just think about diet in terms of our personal habits. It's got to be in the wider context. But yes, from a health point of view, it's got to be less than 70 grams a day for sure, which is one small portion, but it's really not necessary. And I think people are realizing that minimizing red meat consumption for all those reasons is the ideal. And it is acknowledged in the guidelines that 0 grams of red and processed meat is probably the ideal consumption, but if you're going to, then keep it to no more than sort of 50 to 70
and I think
grams.
I mean, you can look at studies all day, but at the end of the day, the actual benefit, like there's nothing essential in that food that's necessary for a human being to function. So if the only thing if it's not necessary and it's going to cause harm for a lot of people, then I think, as you say, we should avoid and definitely stay away from it. Any other things people need to be aware of when they're thinking about cancer and overall lifestyle approaches?
Yeah, well, just with the diet side of things, obviously minimizing the processed and ultra processed foods, which are high in salt, fat and sugar, and also the sugar sweetened beverages is all very much part of the guidance for cancer prevention. Not so much that it's a direct cause of cancer, but it contributes to other chronic illnesses and also weight gain, although there have been a couple of studies that do suggest that free sugar consumption may be contributing to an increased risk of cancer, but I think we need to understand that better and the mechanisms. But clearly free sugar does cause inflammation, which is at the core of so many of our illnesses, including cancer. And the thing that people don't talk about enough, in my view, is that underlying chronic conditions, whether it be the ones that you're dealing with, IBD, or cardiovascular disease, arthritis, type 2 diabetes, just having that underlying condition further increases your risk of cancer because of those shared mechanisms of inflammation, oxidative stress, abnormal gut microbiome, all those things. And I think we don't talk about that in terms of how to prevent cancer enough. So I try and emphasize that because also when I see patients, it's with their cancer, and as I've said already, they have these underlying conditions, so that hampers my treatments I can give them. It increases the toxicity of treatments, it decreases their ability to tolerate those treatments, and then their longer term side effects also increase. So it's kind of a whole package of keeping yourself healthy. I'm not suggesting that you can prevent every single cancer, but if you come to me without those chronic diseases, it makes my life so much easier. It makes your life so much easier to tolerate treatment, and your long-term outcomes are certainly better.
And I guess if you think about it, right, even if you can't avoid every single outcome that's possible in life, isn't it prudent to minimize the risk as much as you possibly can? Like, if you're going to drive a car, you'll drive with a seatbelt, or you drive defensively to make sure that you're not going to be just going through the red light, or just driving through a giveaway sign because you feel like it. You're going to do everything you can to make sure you don't get into an accident. Whereas with diet and lifestyle, people don't seem to think about it until something actually happens. And the other thing is that I find that, while we can talk about different mechanisms all day, how hard is it to actually work out for someone? Because we are all such complex beings. The human body is such a complex thing that how can you, if you think about over someone's lifetime, to pinpoint specific reasons as to why something might have happened to them, it's so difficult, and that's why you get these research papers come out and they can't definitively say something because, well, you just can't. And so if you know something is going to give you the best possible opportunity to minimize that risk of you getting it in the first place, you might not. Nothing's ever 100% in life, but why wouldn't you, take that approach?
Yeah, no, I think that's absolutely right. And we need to do better at sort of the public health messaging on how important it is. And as you say, there's other factors involved as well. Physical activity, that really reduces the risk of more than sort of 13 different cancers, really, and is so important during and after cancer treatment in terms of improving quality of life and survival. And then, we're also not clear on the messaging about alcohol. Alcohol is a toxin. It causes cancer. I think we have to be
It does
clear.
Cause cancer.
Yeah.
Yeah,
1 in 20
absolutely.
cancers globally are caused by consumption of alcohol. That's huge on a population scale, and yet socially and culturally, well, for a lot of cultures anyway, it's acceptable to use alcohol for fun and pleasure and relaxation and all those things. So I am honest with my patients, and then it does come down to personal choice, but I think you minimize certain choices while emphasizing the healthy ones. And I think that's important on the food side as well. If you're choosing processed meat, that means you're not eating enough of the other good stuff, and it's just making those healthy swaps. And it doesn't have to be all or nothing, but it does need to be emphasizing what's good and leaving things like alcohol, if you are going to, for the very special occasion where you feel that you really want to, rather than it being a regular part of your routine.
Absolutely. I think also the other thing that's really important as a health professional, I think it's important to be really upfront with people and explain to them the risks of each decision that they make. Now, what they decide to do with that information is up to them, because everyone has the freedom of choice, right? However, if we're so scared to tell someone that this might be an issue because we think they may not do that. I think a lot of professionals do. We don't think they're going to do that, so I'm not going to tell them that. You don't give the person the opportunity to make that choice, and I think that's a big issue with a lot of dietary and lifestyle related kind of options that are given, or advice that's given to people as well. What about oil?
Yeah, so I mean, oil is a broad topic, isn't there? There's a range of different oils. So there's certain oils or sort of liquid fats or whatever in cooking that I would definitely avoid, and those are the ones that are high in saturated fat. So that includes the animal fats like butter and ghee, and also the plant fats of palm oil and coconut oil, because that there is no doubt, even though there's a bit of discussion, saturated fat does increase the risk of.
I'm going to stop you because you said something very important, especially because in this subcontinental community where ghee is something that's considered very healthy, and we do have a lot of followers who are of that, come from that part of the world. So let's talk about the saturated fat and the ghee, and it doesn't do much good for our bodies and our arteries and other aspects as well, doesn't it?
No, absolutely. I mean, ghee is clarified butter, and you get oxidized cholesterol, and it's just the worst thing for our arteries. We have a single cell layer lining the inside of like our 60,000 miles of blood vessels, and that single layer really has to be kept healthy, whereas we know that these sort of oxidized fats can really penetrate in and cause that inflammation, and it's hideous. I just don't understand where this how it's been so embedded. And I understand it's part of Ayurvedic practices. I also understand that if you were going to have a little bit of ghee in the context of a whole food plant-based diet, well, then maybe that will be okay because you've got all the other beneficial compounds. But to think that any food or compound or whatever is so sort of magical that it will cleanse everything is also a bit of a stretch. But that particular sort of food item, if that's what you want to call it, really has no evidence behind it, as far as I can tell. I find that in my own Ismaili community here in the UK, people have been to India for these retreats, or even they've obviously emigrated from India or wherever, and that's still very embedded in the thinking. So yeah, I think especially for us South Asians, where we know that these illnesses like cardiovascular disease, type 2 diabetes happens a decade earlier, it's twice as prevalent as in white Caucasians, we have to be extra careful. And saturated fat is an absolute no-no. It elevates LDL cholesterol, and then when it's oxidized and penetrates through your endothelium, it causes havoc. And we all know the end result of that. It can be sudden death because that's the first thing you knew, that your arteries were blocked. And it's not, I've got family members who have died suddenly in their 40s and 50s just because of that. And that really is just too late, to state the obvious. So
Absolutely.
yeah, and I think in the plant-based community, obviously coconut oil still seems to be a revered, health promoting food, but I think the science is clear on that. Again, it elevates LDL cholesterol, and we should be doing our utmost to keep LDL cholesterol as low as possible, and that's one of the huge benefits of a diet centered around whole plant foods.
Absolutely. I think you covered the main topics. I mean, I know there's contentious discussions around olive oil and some of the other oils, and from our perspective, we would prefer to eat the whole plant rather than refine the fat out of it and just eat 100% fat. But I guess there's different people who have different opinions on that. But
I wouldn't
I
mind
don't know
just
where you sit
talking
on
about
it.
that, actually. I sort of got tied up in the harmful ones, but talking about ones that could be healthful, the plant-derived oils such as extra virgin olive oil, and it most of the data is around the sort of high quality oils, which is another issue of sort of access and affordability. I think, because I prefer spending my money on fruits and vegetables rather than the really expensive shop-bought
absolutely,
extra virgin olive oil.
and also the amount of availability, but also I find the quality of evidence may not be as good, I find, in some of these studies, especially if they're industry funded. I guess it is a contentious topic, but I mean,
agreed.
our position at High Carb Health is to avoid all refined fats, but that's where we sit on it. But I know other people have different opinions.
I don't have a problem with that. I personally don't use added oil unless you're in a restaurant and you can't avoid, but I don't cook with oil. It's certainly not essential. Fats in the diet are essential, and as you say, you can get it from the whole plant foods. Added oils are not essential, but I think if you're healthy, you're normal weight, you have no chronic illness, then adding small amounts of extra virgin olive oil or canola oil is not going to harm. But how many people in our population these days are normal weight, healthy, without an inflammatory condition? And I think when you have got an illness, you do need to have an extreme approach. And certainly people in our group, and our patient advocate, Kate Dunbar, with a psoriatic arthritis, she clearly finds that added oils exacerbates her inflammation. And I think there is a thing, obviously people with inflammatory conditions do report that, and I think you have to take that on board. And if you can't get rid of the symptoms by being whole food plant-based with some added oil, then try without the oil. You're not going to harm your health, and you may benefit, and you'll be then emphasizing the whole plant sources of fat, and that's absolutely fine.
Brilliant. And the other thing with oil is the calories, because of it's a pure fat, and you've got 9 calories per gram. I think a tablespoon's somewhere around 120 calories. And so now if maybe if you're having half a tablespoon or 1 tablespoon at the most, you'd be maybe okay. But most adults are around 2,000 calories a day. If you're having anywhere around even 3 or 4 tablespoons a day, now you're suddenly looking at 400 to 500 calories that you've added to your diet without even realizing, and that's just mostly empty calories there when you think about it. So that's another thing most people don't realize, is that how quickly you can add on the calories to your diet and not even realize how many you've got.
That's why I say clearly, if you're a healthy weight, but in the UK, sadly, 2/3 of individuals are not. And then if people would like to get some, gains with losing a bit of weight, then oil is an easy win, isn't it? Because of just that calorie density. And I think we've got some really nice studies from the Physicians Committee for Responsible Medicine on where they do use that very low fat, no added oils. They're one of the big benefits of all their studies does seem to be better weight loss, doesn't it? So I think that is clear for sure.
Okay. Now, when it comes to your specialty around hematology and looking at people's blood, let's just talk about some, if you're on a plant-based diet, what are some of the things you need to look out for, and what are some of the myths that are kind of perpetuated around blood results and things like that?
Yeah, that's an important question. In my world of hematology, obviously we've been taught about, meeting iron, B12 and folate requirements because it's a common cause of anemia globally and regardless of diet pattern. You'll know that iron deficiency is one of the commonest deficiencies globally that we're all trying to to minimize, and that's why a lot of foods are fortified. So not a particular plant-based problem, but the reason why it comes up is because, you know, some of the higher source, well, so some of the foods with higher levels of iron tend to be, you know, red meat. But as your viewers will know, you know, kind of the iron in plants and animal foods is different, and there's some benefits from obtaining good sources of iron.
Well, some people may not know. Do you want to explain the difference? Some people may not know.
Sure. I mean, so in animal foods, we have a compound called heme iron, which is part of the hemoglobin and the myoglobin. Myoglobin is found in muscle, and hemoglobin obviously crucial for carrying oxygen in our blood cells. And that heme iron is utilized by the cells, but when there's too much of it, it can cause this oxidative stress and inflammation, because iron is quite a toxic substance. Whereas in the plants, it's sort of the non-heme, it's a kind of a different type of iron that you know, is present in the plants. It's absorbed less easily from the food, but it's more regulated, so you're able to increase the absorption when your body needs it and decrease the absorption when your body doesn't need it. Whereas the animal-based iron, your body just keeps absorbing more and more as you eat it, and then you have that problem of sort of having too much and you know, potentially increasing your risk of illnesses such as cardiovascular disease and type 2 diabetes. So the plant-based iron is a bit more you know, sort of clever in a way that it sort of meets your own body's requirements, but you do need to be mindful of making sure that you do have good sources in the diet, because, you know, often our diet isn't varied enough, is it? You know, we reach for the same breakfast, same lunch. I'm guilty of this. I could eat the same meal, you know, 3 times a day and not worry about varying it. So I think, you know, you do need to be mindful of having a variety of foods so you're meeting all your requirements. But it's not difficult. You know, greens and beans at the end of the day are really great sources of iron. Having it having it with a bit of citrus or vitamin C increases the absorption. Maybe using an iron cast cookware can help as well. And then removing things in the diet around your meal times, like teas and coffees, that can inhibit the absorption. So there's some simple things. And as I say, iron deficiency really common in adolescents, really common in menstruating women for obvious reasons. And so sometimes, like with any diet pattern, if you have low iron stores, then you might need to take supplements, and that's fine. I think, you know, it's fine to be taking supplements if you need it. But also we know that people on a plant-based diet have lower iron stores, but that doesn't mean that they're iron deficient. So the iron stores are often measured by the compound ferritin, which is stored in our cells like the macrophages, and that ferritin can be lower in the normal range compared to people on an omnivorous diet. And again, it's totally fine. That's fine. I'm not particularly worried about lower end of normal, but you do need to be within the normal range. And there may be some benefits, as you've said, of having slightly lower stores, because it means you've got less of that sort of toxic iron circulating as well. So that's something to be mindful of. And then B12, obviously a common deficiency, certainly with aging, as our acid level reduces in our stomach, as we take more and more medications. You know, certain medications like metformin and those that block the acid in our stomachs can reduce the absorption. It's not made by animals or plants, as you know. It's made by microorganisms, and we sort of can have it from obtain it from animal products. On a plant-based diet, you do need a supplement, or you can get it from fortified foods, where that needs a little bit more effort. So B12 in a supplement. And in the US, certainly they recommend everyone over the age of 50 takes a B12 supplement. It's not so rigid here in the UK, but B12 deficiency is common, and the people with B12 deficiency in the UK are not predominantly vegans. You know, we have less than 1% vegans in the population, and people coming into a hematology clinic with B12 deficiency, I can tell you, are not predominantly vegan.
No, yeah, and that's the thing. I think it's only B12 is only a vegan problem, but it's a worldwide problem because of the way we live now. We're not coming into contact with bacteria and other microorganisms as often as we did in past years, which is obviously a good thing. You know, sanitization and all those things are great. You know, they've drastically reduced the ability for us to pick up communicable diseases, but I guess from that perspective, from B12 perspective, it's not as good for us. But as you said, it's easily resolved with a supplement, and then you're done. So yeah, that one's easy. And you mentioned folate. Did you want to discuss that a little
Oh
bit?
yeah, I mean, it really shouldn't be a problem, right? I mean, it's so abundant.
Yeah, it's so easy. Yeah.
I do wonder sometimes when I'm, measure it and it's low, and then people go, "Oh, I'm having a healthy diet," but I'm like, "But where are your leafy greens?" But yeah, so really
comes from the
easily
word
obtained.
foliage, doesn't it?
Yeah,
Folate, yeah.
absolutely. Yeah, so I mean, really, we know from studies, we don't even need studies to tell us that those in a plant-based diet get much more folate than those on who aren't. So it's more of a problem on an omnivorous diet. People who are drinking too much alcohol may have inhibition of absorption. People who aren't eating a varied enough diet, and yeah, the greens. So yeah, sadly, we've also got, well, certain countries have started fortifying flour and things, haven't they? There's a bit of a debate in the UK about whether there should be fortification of flour products because of folate requirements, but it seems a ridiculous problem to be dealing with, doesn't it? I think we should aim to be getting it from whole plant foods. I mean, there is a small, I mean, we shouldn't be aiming for supplements there. You should get it from the food, because there is some weak evidence that taking too much folate, sort of especially with supplements, could have an adverse impact on cancer. But I mean, getting it, I've never heard of that through eating it through food, and your body will regulate the levels. Absolutely. So yeah, lots of leafy greens.
And there is evidence that supplementation, if you do too much of it, or if you're not taking care with just taking for the sake of it and things like that, can actually cause harm to the body, because it's not a natural compound. You're overdosing in most situations more than what you'd normally get on a healthy diet, and so you need to be careful and only supplement, apart from B12, maybe some people with vitamin D, but really you should really be thinking, okay, do I really need to take the supplement, or is there something else I can do to assist from a dietary perspective? And if that means you need to talk to someone who knows about how to structure a diet properly, then do that instead of spending all that money on supplementation, and you're going to be healthier for it.
Yeah, I totally agree. And that's something I do see in my patients. Actually, lots of people, regardless of their diet pattern, seem to be having vitamin C and zinc and various things. And I'm like, really, I think we shouldn't. And certainly, during cancer treatment, having those sort of antioxidant type supplements is not considered a good thing to do, because there could be interactions with treatment. So yeah, I agree. More studies than not have shown harm of high doses, because diet is complex. It interacts. Your body's able to take the nutrients it needs. It interacts with other compounds. Whereas you just take something in isolation, then it doesn't have that same effect.
And the other thing with the supplement industry is it's not very well regulated. So you don't really know what you're getting. It might say something on the bottle, but who knows what's in there. And so you shouldn't, we shouldn't rely on that. We should really look after ourselves as much as we can.
Agreed.
Anything else from a blood count perspective? Like, so a lot of people that follow us, they've got IBD. And if I talk to you about some of the things that I see more often with people when they get blood tests back to me, I mean, obviously I'm not a medical expert, but and I can see patterns in blood tests. What I normally tend to see is because people tend to have a lot of diarrhea, their sodium potassium balance can be out of whack. Iron levels with the bleeding in the stool with IBD can obviously be low because low blood volume. And I also see something called albumin. It comes up quite often because the liver is responsible for producing albumin, but when there's inflammation, it produces cytokines instead of albumin. So I see quite a regular thing around albumin levels being low when people have been inflamed for a period of time. So is there anything else apart from those three things that people should be looking out for?
No, so I mean, I think there's been a couple. Well, the really good study was from the UK Biobank, looking at people in the study with different diet patterns, and they did show that people on a vegan diet did have slightly lower platelet counts and slightly lower neutrophil counts, but still within the normal range. But then the normal range only takes account of 95% of the population, doesn't it, really? So there's always going to be some outliers, but really not really. I mean, I think your neutrophil count could be slightly lower, and it might reflect the lower inflammation on a plant-based diet.
Platelets as well, isn't it? Platelets shows like activity in the body. Yeah.
Yeah, but as I think we've discussed in the past, if you've got one autoimmune condition, you can get another autoimmune condition, and autoimmune causes of a low platelet might be increased in people with arthritis and IBD and things. So that's something we deal with, sort of that immune low platelet count. But those sort of things are not really diet related. I think if you're meeting your nutritional requirements, you know, when you have inflammation, there is upset of the balance of a lot of nutrients that then can affect the blood counts. And, you know, if you're chronically unwell, you can have an anemia of chronic disease. But all of this comes down to treating the underlying condition, of which obviously a healthy diet is part of it, but you do sometimes often need a period of sort of conventional pharmaceutical medication to get things under control before you can really start sort of getting diet and lifestyle factors addressed as well.
Yeah, absolutely. I found that people who've got quite severe disease, they can really benefit by taking a course of either steroids or other anti-inflammatory medication. Because what that I find, I mean, I can't say for sure, but through my own experience, what I find is that seems to help with the gut permeability issue. And so because the inflammation is low, the body seems, because they're eating fiber and a lot of healthy plant foods, they seem to be able to get control of their gut permeability. And then when they do decide eventually that their numbers are good enough to come off these medications, because you haven't got the leaky gut situation, you're not getting the inflammation, and the symptoms are much more controllable. So there is that role, especially if you've had it for a long time, or if you've had a lot of gut permeability issues, that maybe there is a benefit there for a period of time while you sort out your diet and your lifestyle and a lot of other things. It does give you a bit of relief in the meantime.
Agreed. And I don't think we should shy away from using things that are going to help you. It's just, we have to use everything that's available. And, we meet people in a very extreme position, don't we? And we the quickest way to get inflammation down, maybe steroids or other disease modifying drugs. And same for me with lymphoma. I'm not going to be treating lymphoma with diet, but having a healthy diet and lifestyle before, during and after is going to help people live a better, longer life.
Yeah, absolutely. All right, well, I think we covered a huge range of information there, and I really appreciate you taking the time to share your knowledge. I think a lot of people are going to benefit from that, so thank you for that. Is there anything else you wanted to share in terms of some of the things that we've covered that we that have been in your head that you may want to just talk to the audience about, or some of the things that you see from the work that you're doing that people should be aware of?
Not particularly, only just to have the confidence that a plant-based diet, be it 85%, 90%, 100%, is the best choice that you can make. So go for it and find the right information. And just to reiterate that so much of our education offering at Plant-Based Health Professionals UK is completely free of charge. So check out our fact sheets. Our live webinars are also free, although it might be at not a great time for your Australian and New Zealand audience, but we, and then we do lots of free online talks and stuff. So just find the information, follow us, and make use of all our resources and reach out to us if you've got any questions. Very happy to be involved. And
I'll put the link to all of your your website and your social media platforms in the description there below. So definitely would recommend you guys follow Plant-Based Health Professionals UK, because they do put out a lot of really interesting things, and a lot of great information comes from Dr. Shireen and her team. So thank you so much for joining me. I think we've covered a range of things. I think a lot of people, some of these things that most people aren't aware of, especially around the blood counts and cancer, even, that there's a few things there that I wasn't aware of. So thank you for sharing that. And for everyone who's watching, thank you so much for taking the time to either listen to the podcast or watch the YouTube video. If you're watching on YouTube, please give this video a like and hit the subscribe button. So and also that little bell notification icon will give you updates of all our latest uploads. And if you have any questions from any of the things that Dr. Shireen has talked about, please let us know in the comments, and we'll be happy to answer them to the best of our ability. But for everyone out there, thank you so much for watching again. Eat plants, and lots of them. Thank you, Dr. Shireen.
Thank you. you.